Sure can. Thanks, Dan, for joining us. And so today we have a series of thoughts we wanted to put to Dan, but just learn a little bit about what he does in his practice, and also how he's starting to integrate and use AI and automation and technology, and get his thoughts on maybe where it's headed. So hope everyone's strapped in for this, and we'll get started right away. So Dan, if you're ready, I'd love to know a little bit about your practice, so Serene Living Counseling. I'd love to know what inspired you to establish the practice and what the core values are behind your approach to therapy.
Well, I'm going to spare everyone the super long background as to what inspired a number of life events, both tragic and fantastic. So let's take that as a summary for why get into this line of work. Specifically, we established, so I come from the technology industry, so I guess maybe I'm one of your bipolar potential colleagues here. Coming from the technology perspective, I've been excited for the advancements that can be made, and have jealously watched them happening on the physician side, and so was super excited when Cliniscripts came in. What our therapy practice was established to do was to bring services to the local community that we serve, which is Burlington, Hamilton, and Oakville, to make them more accessible. So we do a lot of sliding scale work. We do work with the Victim Quick Response Program for those that have experienced either part of sexual or physical crime. And our role really is to work ourselves out of a job. So we try to do our work with the intention that we're going to exit, leaving clients in a better position than when we started, and as quickly as possible.
Fantastic. And obviously, with the increased demand for mental health services, accessibility has become crucial. We'd love to know how Serene Living has adapted to provide flexible options such as online therapy to meet the needs of your clients.
Yeah. So being a technologist and having worked remotely for almost 20 years, that part wasn't new for us. What was new was trying to apply those in a clinical setting. And so really COVID forced us to do that. We had done some, let's call it teleconference or telephone therapy for a couple of years before COVID-19, but COVID-19 really forced us to focus on being able to deliver it remotely. So we had to go from 2 locations down to 1 in order to be able to support it. So we closed 1 location during COVID, and then really focused on finding the right set of tools to enable online therapy. And what we found is that gave us flexibility in terms of where we work from, and the reach we can have, the reach for clients who are on the move. It was also really beneficial from a generational perspective. Some clients just preferred to be remote. We never went so far as to provide it over text-only means like chat, but we did do both phone and video therapy, but it did mean some change. For therapists, it meant learning to adapt to which senses you can use to read nonverbal communication, and a reduced field of view, in particular for couples or families where you can see much less. There's some adaptation that we've had to go through and understand. And then the other area, since we also treat screen addiction, is learning to determine when clients are multitasking or doing something else on the device they're using to have a session with, and being comfortable trying to address it. And sort of bringing them back into the session.
Super, thanks for that, Dan. And obviously, as our topic du jour is AI, and obviously it's changing many industries. We'd love to know, how do you see AI impacting the field of psychotherapy? Your thoughts on how it's integrated, and how you are potentially using it today.
Sure. Look, it can have the initial reaction to AI can kind of depend on your perspective and your education, the experience you've had, from fear mongering of, all the movies like war games that played into the risks of turning control over to a machine, to people who've experienced the tremendous benefits it can bring. So, I think, Michael did a good job sort of outlining some of the potential areas of concern, so I don't want to repeat them too much, but obviously privacy is a big one to pay attention to. And as Michael said, validating what we get from AI at this point in time is still really important. We're a regulated industry. We're typically quite conservative because a regulatory college encourages that and ensures that's happening. So that means we need to enter this, albeit cautiously, but also with being open to what it can provide, educate ourselves on what it can do for us, and then implement it safely. I mean, that was true also of implementing video to talk to clients remotely. There are platforms that were inappropriate and platforms that were appropriate and met the necessary Healthcare Act requirements.
Great. And with the emergence and all the discussion around these AI-powered tools and apps for mental health, in what specific ways do you believe AI could be a valuable supplement to traditional therapy? And you've hit on a few of these, but what you might identify as some of the limitations?
Right. Well, again, as Michael alluded to, note-taking is a great one. I first ran into note-taking with my general physician who was using it, had been using it for about 12 months before I started to adopt it. And I was really excited about what that could mean overall for the industry, and some of the concerns about making sure it's not remotely in the cloud and it's sitting local on the technician's computer or laptop, helps ease some of those concerns, being able to eradicate any presence of the raw transcript that was taken and just taking the notes and appropriately storing them in a patient management system that's approved. These are all important pieces that we need to be aware of as clinicians to make sure that, we're still following the rules of the college. I think AI can really give us some benefits though. So in addition to the time savings, which I have to tell you, if you haven't tried it, it's amazing. What would be 2 hours of note taking after a long day of seeing clients, we're down to minutes. It's amazing. But yet you do have to read them and just make sure that some things don't need to be updated or changed. But overall, it has been very accurate. But it can lead to standardization of diagnoses. And, in Ontario, psychotherapists are not supposed to diagnose. That should come from a physician or in some cases from a psychologist. But even understanding the groupings of symptomology and then being able to understand, this might look like depression or this might look like anxiety, the consistency we could drive by having access to this major pool of information of different diagnoses that have been appropriately diagnosed and saying, okay, just like the DSM-5, many of the particular mental health diagnoses depend on 5, 6, 7 criteria, and being able to have those compared to the DSM-5 and compare it to a really large pool of already diagnosed patients means we could drive some consistency, not only in how we diagnose, but also how we then treat, right? So being able to give recommendations of when you see these consistencies, these 3 or 4 therapies tend to be more effective. Understanding access to research data. So for example, depression and anxiety, we see overall better results, scientifically speaking, if sometimes medication and talk therapy are used, and being able to provide recommendations back to the therapist or to new therapists who are learning, or even, we're starting to see, I think, Michael, you referred to this, but we're starting to see AI robots doing situational learning, meaning they have enough information where they can react live to a conversation so that as students are practicing, they could practice in a very safe environment before actually taking that to an actual client.
Super. And clearly, just to expand on that, obviously, Dr. Brown had a really thought-provoking segment on the ethical considerations. And what safeguards do you believe are necessary to ensure that client privacy and data security are being treated appropriately with these AI tools?
Well, sadly, I think there's inconsistency in the industry, even without AI, in terms of making sure we adhere to all the policies and requirements for the college. I mean, if we did a random survey of every psychotherapist, you want to take any bets on how many of them actually have an encrypted hard drive with the secretary and 2-factor authentication? I'm not going to hazard a guess, but I'm going to guess. I think it's probably not high enough. How about that? So, to some extent, we have these issues with or without AI. Obviously, maintaining the sanctity of personal information and health information is really important. And as medical health practitioners, we don't necessarily all have a super deep technological understanding. So if I were to kind of break this down in what was the term you used, Dr. Brown, grade 7 speak, I think, I would point it like this. Okay, there's a great case out there where some people who were coding at Samsung needed to solve a problem. They uploaded it to ChatGPT. They got an answer back. They put it into their solution, and Bob's your uncle, until it came to light that all the intellectual property that Samsung thought was its own was in fact no longer its own because they'd uploaded it to a public AI brain, and hence now that was out in the public. It created a lot of issues around intellectual property. We have the same issue in healthcare, only more importantly. So there are ways to implement AI to protect data sources. And the way you do that is you take one of these brains or large language model, and you point it at sources to say, this is an authoritative source, this is an authoritative source, this is an authoritative source that doesn't contain personalized information. So for example, I can point it at the DSM-5. This is an authoritative source for how to diagnose. I could point it at a bunch of studies which have come up with certain conclusions based on certain parameters, as an example. I can point it to any kind of data source that's randomized and personal information isn't a part of. And then I can take symptoms from an actual client without identifying the client and tell that brain, hey, if these are the symptoms, what can you tell me about things I should look for? What would be the best treatment paradigm? Because we're not giving over private information. And that's they call it an architecture, the way that's designed. It's specifically called a retrieval augmented generation architecture. In the industry, they shorten that to RAG. And that provides some of the necessary safeguards to make sure that the mass learnings of AI don't take personal or private information or intellectual protection, IP information that shouldn't go out there, and keep it secure. Okay, and then we get all the benefits of what an AI can do for us while protecting the information. So if we do that, we can do it in a safe and reliable manner. I think it's going to be a crawl, walk, run scenario before we see all the possibilities of what it can do.
Amazing. And I just have one final question for you, Dan. And I think in a lot of my conversations, certainly with therapists, there's the conversation about human connection comes up. In your role, how do you see AI evolving alongside you as the therapist and the advancement of AI as a technology?
That's a really good question, because I think where AI has advanced to thus far, we haven't seen amazing examples of being able to generate something equivalent to the therapeutic alliance or a relationship. It's early. That's not to suggest that it can't or it won't. And we've certainly seen some examples of it successfully doing that in these sort of training modules or chatbots that can adapt and ask relevant and personalized questions based on the circumstances and the information gathered so far and compare it to other data sources. I think, though, we're just not at that point yet, and I can't tell you when that will be. And I, too, have no interest in trying to predict the future, because I've never been good at it, and I'm not going to start now, because if I did, I would just buy lottery tickets. But what I would say is chatbots can answer questions or respond to questions or generate questions. What they can't necessarily do is adapt to the intuition or the emotional content or the nonverbal content. It's getting better. So, they have these meta glasses now by Facebook and Ray-Ban that can look at a picture and determine what's in the picture and start to analyze it. I think that will grow, which in theory, then, if you had video cameras pointing at a session, you would be able to read some body language and characterize it. But it's just far away. And until that becomes possible, I don't think replacing the therapeutic alliance is highly probable. Now, I did hear Dr. Brown say that there was a study done and people did react to chatbots and said, they felt like there was a relationship there. So I could stand to be corrected possibly. But being able to ask Socratic questionings and be fluid enough to be able to move means there is a lot of learning that AI still has to go through. So I think using it to harness repeatable actions like note-taking, characterizing symptoms, pointing therapists in the right way based on intervention strategies and tools, those are probably, for now, really good and possible safe ways to go. I think adapting it up to being able to understand the human emotion, the human experience, particularly with more challenging cases that don't follow prescribed outcome, like, say, grief. We know the stages of grief, but somebody can be at any stage in grief at any single time, and they can move from one to the other, and it's not sequential. So, how do you sort of teach that to an AI model to be able to adapt? I think long way to go. Excited about where it is already and what it can do. I think developing an interpersonal relationship, that remains to be seen.